So epidurals have become this kind of point of contention, right? Initially, they were just about pain relief, but then hospitals realized really quickly that they could use it in a patient management type of way. Um, and what I mean by that is when you have a client, when you have a patient, in the case of a hospital, when you have a patient who is in bed, who is comfortable, and who's on the monitor constantly, um, you could have one nurse to 2 or 3, or I've even seen 4 patients at a time. So it's more of a work smarter approach from a business standpoint. It's not always the best kind of care, but if your nurse can see all of her patients on a computer screen and see their vitals, and vitals are really the data that we need to be able to defend in court if there's something that goes wrong, then as far as the hospital's concerned, everything's fine, because it's really from a business standpoint. It's not from a human-to-human care type standpoint. Now, from a doula position, right, a lot of doulas were never trained and still are never trained in what to do with a client who accepts an epidural. It's the problem because you're looking at 95 to 99% of patients who enter a hospital who accept an epidural, doula or not. And so I've been doing this for about 30 years, and I've seen doulas who leave their patients after they've gotten an epidural because they figure, oh, you don't need me anymore, because doulas have this mindset that their only job is to relieve pain somehow in labor, and that's not your only job. So they leave because they think, oh, I'm not needed any longer. And that's really sad because that's only a small part of your job. Another thing that I've seen is the epidural gets placed and now the doula just knits, plays crossword puzzles, or just sits on her phone the whole time, or even goes and leaves, to come back. And if it's a marathon birth, taking a nap or going and getting a meal, all that's really, normal and fine and needed. You need to take care of yourself. But for someone to say, I'm going to leave and call me when you're pushing and I'll come back, like, you've really missed out on a lot of what you should be doing with that patient. So this is why this lack of knowledge and lack of confidence and lack of the feeling like I have something to contribute on the doula side of things is why we created the EpiDoula program. It's really all about helping doulas or other birth workers, even nurses, to understand what are the pitfalls, what are the complications that come, what are the snowball effect interventions that come once an epidural is placed, and how can we reduce the problems, right? How can we reduce bad outcomes in that scenario, and giving those tools to doulas, to nurses, to family members, other birth workers, giving those tools means that they stay and they're an active participant. Because keep in mind, just because mom's not feeling the pain anymore doesn't mean that she and her partner and her caregivers shouldn't stay engaged in the labor, because guess what? Baby's still feeling everything. She might not be feeling everything, but her baby is. And so we need to stay engaged as well. And it is quite a shock when you have been disengaged from your labor experience and then all of a sudden, poof, you have a baby in your arms. That can create problems of its own, after the birth. So take a look at our EpiDoula program, see if that's something that you would like to beef up your skills with, and we would love to see you there. Our next one is coming up soon, so get registered today.